When we're talking about bone health, like what does that mean? What are we striving for?
There's a lot of different measures of bone health, and I don't think that we fully understand all the different parameters that go into it. The easiest thing to measure, or what we measure most, is BMD, bone mineral density. And a DEXA scan or dual X-ray, see if I say this right, absorptiometry, just DEXA. That's what measures that. And it provides you with, generally for ages 20 to 50, a Z-score. There are also measures of bone mineral content, bone geometry that all play into your bone's ability to resist or tolerate loading. But the thing that we look at most, I'd say right now in the research, and then just what we have access to from a imaging perspective, is the bone mineral density. And yeah, just to kind of finish up why that's important. The lower your bone mineral density, the poorer bone health you have, the more at risk you are for fractures. And of course, that impacts us runners because we have more time off, or that impacts our mental health and also physical health. But long term, the kind of the zoomed out view is we know after you have a hip fracture as a whatever age, in your older age, you're more likely to pass away within the next several years. So a higher mortality rate among those who have a high fracture risk, unfortunately. So it's not just this view of like, oh, this is really hard, I have to take a season off or miss this race. It's more of like, how can we optimize this so that I have a higher quality of life 30, 40 years down the road?
Is there a subset of the running population who you know to be at higher risk for lower bone density?
Yeah, the biggest risk factor, well, one that's uncontrollable, is being female. It's not fully known why that is. My guess is because of the relationship between low energy availability, history of eating disorder, and we do see that in males, of course. However, it's more, the incidence is higher in females. But that relationship with low bone mineral density, I think, is what creates that risk in females. But that's one of the biggest things, is that we know for sure. There's a lot of like, maybe this contributes, maybe this doesn't, but for sure we have a lot of evidence that low energy availability, history of eating disorder, particularly anorexia nervosa, increase your risk for fracture.
I do know of the little that I know about bone health. I do know that adolescence and puberty is a really key time for developing stronger bones, and that we look at the incidence of, like you said, low energy availability, disordered eating disorders, and especially in adolescent female athletes, right? If they're amenorrheic, right? So loss of period, it interrupts a really, really key period of their life that is important for establishing the bone health and density they need going into adulthood, which can then down the road really cause issues. And so I think even for, listening to this and thinking back to my own adolescent self who struggled with disordered eating, I was like, oh, gee, like I probably didn't do the best that I could for my bones at the time. But it's interesting to think about this, that bone is still a living tissue. And just because you went through a period where maybe you weren't taking good care of your bones and maybe you did miss the optimal window for bone health establishment, that doesn't mean that you're stuck with that for the rest of your life.
Absolutely. Yeah. And I think that's a big misconception. Of course, it is ideal to optimize your bone mineral density during those formative years. And we typically reach peak bone mineral density before age 25. And so I understand why that's been discussed as, you need to do this during this time. However, I personally have, and I have several athletes I've worked with who have improved their bone mineral density after age 25, even into their 50s. So this isn't something that, it can be really easy to look back and feel guilty or shameful that, maybe we didn't take care of ourselves because we didn't know any better. But you can start now. And you can improve your bone density and set yourself up for a better quality of life in the future.